Now, as the world marks Breastfeeding Week, some health practitioners in Lagos are up driving awareness on breast cancer while also encouraging women to go for an early checkup, as early detection saves lives. Breast cancer is a global health challenge and the second leading cause of cancer death in women. The group believes that with more advocacy on the need for early detection and cancer management, the rate of fatality can be reduced. Now, for a deeper look at tackling breast cancer, I'm now being joined by an oncologist and Director of Innovation and Research at the Berkeley Cancer Center, Adora Enyi. Good afternoon.
Good afternoon. Thank you for having me.
Now, in Nigeria, the occurrence of breast cancer is high amongst women. What do you think can be done to stem this?
Of course, in Nigeria and in many parts of Africa, breast cancer is the most common type of cancer affecting women. 1 in 8 African or Nigerian women have a lifetime risk of developing invasive breast cancer. And so today, what we're calling on all women is that women, you should know your breast, right? You should get screened early. You should empower your breast health. Get screened as early as possible. So women within the reproductive age group, you should get your screening, check your breast from time to time, do a clinical breast examination, do a self-breast examination, do at least 1 breast imaging in a year. Know the nature, the texture of your breast, right? If there are any symptoms, if you feel a certain way, if your breast feels a certain way, if it feels like there's a lump, there's a discharge, it doesn't look the normal way you know it to, go get your breast check. We also advise that because breast cancer affects especially the younger women, and some of the risk factors will include things like nulliparity, so women who have never been pregnant before, women who have their first delivery over the age of 30, women who are on oral contraceptives, women on hormone replacement therapies, women that attain their menopause late or attain menstruation very, very early, that exposes them to a large outcome of the hormones called estrogen and progesterone, and then women who are typically obese. So we always advise that all women check your breast. And courtesy of Berkeley Cancer Care, we are offering a program in partnership with our funding partners, ACT Foundation and Access Bank, to screen over 1,000 women. And
yes. Now talking about early detection and treatment, what's very crucial areas of treatment or process must be understood?
So what is very important to know is that firstly, a woman needs to know how their breast looks and feels from time to time, and we call it the TLC. So touch your breast, learn how your breast looks like. So look at your breast from time to time and then check your breast. So the TLC of breast health. Once you've looked at your breast, you've touched your breast, you've checked your breast out, you've seen how it looks like, the second thing we always recommend is that a woman gets an imaging test done. So you go into a facility and get a radiologist or a radiographer, someone, a specialist in radiology or breast imaging, to either do a breast ultrasound scan if you're below the age of 40, and if you're above the age of 40, to get a breast mammogram done. And these imaging will tell us any changes that are occurring within your breast, and we can take action immediately. Typically for women who have normal findings, we always recommend that you at least do it every 1 to 2 years. So you get a mammogram done at least 1 to 2 years. And for women that there are findings in the mammogram or in the ultrasound scan, then there are treatment modalities that range depending on the nature of the findings seen.
Tell us quickly what the neglect of proper treatment procedures can lead to.
So the neglect of popular treatment, as we know very well in Nigeria, breast cancer, as I said, is the most common cancer affecting women. But what is even sad to note is that 60% of these women that are affected by breast cancer actually end up dying from breast cancer. And even though breast cancer can be properly taken care of if detected very, very early. And so what we always try to advocate is that once you get a breast mammogram or you get a breast imaging, able to detect it when it's still a simple lump, when it's still benign, when we can do interventions like surgery or a lumpectomy to take out the breast, or we can manage you even when you come in a much maybe in a later stage, like maybe stage 2 with chemotherapy or even radiotherapy. But what we know is that 60% of our breast cancer cases end up dying because they present in very, very advanced stages, in end stages or stage 4, when there's really not much to do. And so hence why we are preaching that every woman, once you feel otherwise normal or you feel fine, please get your breast health.
Yes, yes. And now, just before I let you go, is it possible for a cancer patient to breastfeed? Someone who has breast cancer, is it possible for her to breastfeed?
So that's a bit controversial. So women that typically have breast cancer, it's not like you're going to transmit anything, but because of depending on the nature of that breast, it's advisable to abstain from breastfeeding for that time, especially because a woman that would have breast cancer would typically be on some form of chemotherapy or some form of immunotherapy or targeted therapy. And so it's always advisable to abstain, from breastfeeding at that point in time because, of course, because you're ingesting so many medications, you don't want to transmit that into your baby. So we always advise women to abstain during that period.
All right. Thanks indeed for your time with us, Dr. Adaora Eni. Thanks.
Thank you.
For talking to us.